Welcome back to UK Pro Writers, where we delve into critical research topics shaping our world. Today, we're diving into the assessment of World Bank-funded health projects and their impact on public health indicators. Strap in, because this research is not just about numbers, it's about the lives touched and the diseases battled. Importance of the research topic. Assessing the effectiveness of World Bank-funded health projects is crucial for ensuring that international development efforts translate into tangible improvements in public health indicators, directly impacting the well-being of communities in developing nations. Understanding the success and challenges of these projects is essential for policymakers, allowing them to allocate resources strategically and refine future interventions to maximize their positive impact on life expectancy and disease prevalence. This research contributes to the broader global health discourse, providing evidence-based insights that can inform decision-making processes, enhance accountability, and foster collaboration between international organizations, governments, and local communities in the pursuit of better public health outcomes worldwide. Real-world examples. In the case of a World Bank-funded health initiative in sub-Saharan Africa, the implementation of community-based healthcare programs led to a notable increase in life expectancy. By focusing on preventive measures, such as vaccinations and maternal health care, the project not only addressed immediate health concerns but also contributed to the region's long-term demographic and economic stability. Consider a World Bank-funded initiative in Southeast Asia targeting malaria control. Through the distribution of insecticide-treated bed nets and the establishment of local healthcare infrastructure, the project significantly reduced the prevalence of malaria in the region. This not only alleviated the burden of disease on the population but also demonstrated the effectiveness of targeted interventions in combating specific health challenges. Chapter 1, Introduction. Chapter 1 typically includes the introduction to the research, outlining the research problem, significance of the study, research questions, objectives, rationale, and may set the stage for the entire research by providing an overview of the key themes and concepts that will be explored in subsequent chapters. It serves as a comprehensive introduction, framing the context and purpose of the research. Research problem. Before we embark on this journey, let's identify the problem. Imagine a country grappling with a rising disease prevalence despite significant investment in health projects. The puzzle here is understanding why the expected positive outcomes aren't matching the resources poured into the system. Research significance. The significance lies in our ability to optimize these investments. If we can pinpoint what works and what doesn't, we can better channel resources for improved public health outcomes. Research questions. How do World Bank-funded health projects correlate with changes in life expectancy? What is the relationship between project implementation strategies and disease prevalence? Are there disparities in the effectiveness of these projects across different regions? Research objectives. Evaluate the impact of World Bank health projects on life expectancy. Analyze the correlation between project implementation methods and disease prevalence. Identify regional variations in the effectiveness of health projects. Research rationale. The rationale behind this study is clear. Understanding the nuances of project impact helps us fine-tune strategies, ensuring our efforts align with the goal of improving global health. Chapter 2, Literature Review. Chapter 2, the Literature Review, provides a thorough examination of existing scholarly works related to the research topic, summarizing and synthesizing key findings and insights. It typically includes a critical analysis of relevant theories, models, and studies, identifying gaps in the literature that the current research aims to address. Suitable subtopics. Effectiveness of international aid in health. Impact assessment of health interventions. Global health disparities in project outcomes. Theories and models. Health belief model. Understanding how individuals perceive health risks and benefits can inform the design of interventions. Social ecological model. Examining how social and environmental factors influence health outcomes at various levels. Diffusion of innovations theory. Exploring how new health practices or interventions spread through populations. Literature gap. Despite a wealth of information, there remains a gap in understanding how specific project strategies influence long-term health outcomes. This research aims to fill that void. Chapter 3, Methodology. Chapter 3, the methodology chapter, outlines the research design, conceptual framework, and methodological approach employed in the study. It covers details such as the research philosophy, strategy, choice, and ethical considerations, providing a roadmap for how the research will be conducted and analyzed. Conceptual framework. Our study will examine the relationship between three independent variables: funding allocation, implementation strategies, and regional health infrastructure on the dependent variable, public health indicators. Research philosophy. Given the exploratory nature, a mixed methods approach, combining both deductive and inductive reasoning, seems most appropriate. Research strategy. A case study approach will allow us to delve deep into specific projects, capturing the nuances of their implementation and impact. Research choice. A quantitative approach, supported by qualitative insights, will provide a comprehensive understanding of both the statistical trends and the contextual intricacies. Data analysis method. Quantitative data will be analyzed using statistical methods, with a sample size determined through power analysis to ensure robust results. Ethical considerations. Ethical considerations include safeguarding the privacy of participants and ensuring unbiased reporting. For instance, obtaining informed consent from individuals participating in health surveys is crucial. Limitations and delimitations. Every study has its boundaries. Acknowledging limitations, such as the availability of historical data, and delimitations, like focusing solely on World Bank-funded projects, ensures the study's credibility. Chapter 4, Data Analysis. Chapter 4, the Data Analysis chapter, presents the results of the study based on the methodology outlined in Chapter 3. It includes the analysis of both quantitative and qualitative data, along with discussions of key findings and their implications. Quantitative analysis. For quantitative analysis, a sample size of 5,000 individuals, selected through random sampling, will allow us to draw statistically significant conclusions. Qualitative analysis. Qualitative data, gathered through interviews and focus groups, will be analyzed thematically, providing depth to our quantitative findings. A sample size of 30 participants will ensure diverse perspectives. Chapter 5, Conclusion Recommendations. As we reach the conclusion, the puzzle pieces start to come together. This research isn't just about the numbers, it's about enhancing the lives of those affected. Recommendations are not just suggestions, they're pathways to improvement. Streamlining funding allocation based on regional needs, refining implementation strategies, and fostering cross-border collaborations are just a few steps in the right direction. Future research suggestions. Our journey doesn't end here. Future research could explore the long-term sustainability of health projects, the role of cultural factors in project success, or the influence of political climates on international health collaborations. That wraps up our exploration of assessing the effectiveness of World Bank-funded health projects. Don't forget to like, subscribe, and share if you found this video insightful. Stay tuned for more research insights on UK Pro Writers.